Hello, my name is Abha Khandelwal, and I'm a cardiologist at Stanford. I serve as the cardiovascular clinic chief for the outpatient clinics. I'm also a clinician that sees patients in our South Asian Translational Heart Initiative program, or SATI program. I think it is very important that we talk about cardiovascular health in South Asians, particularly in the time of this pandemic. What we know is South Asians are at increased risk for cardiovascular disease. We know in the Bay Area that they are likely to have their cardiovascular event 10 years sooner than their Caucasian counterparts. We've done research here at Stanford looking at traditional cardiovascular risk factors and how they interact in South Asians. We look at hypertension, high cholesterol, blood sugar control, smoking, vaping behaviors, exercise patterns, and dietary intake. Understanding our risks is the first step to addressing them. We'll start with blood sugar control. We know that South Asians tend to have more insulin resistance at similar BMIs to Caucasians. In fact, because of this, the American Diabetes Association a couple years ago decreased our body mass index cutoff to 23 from 25 for South Asians. Insulin resistance is a condition where our tissues, our muscles, do not utilize insulin as effectively. In fact, they need more insulin to metabolize the same amount of glucose. We believe that over time, if not treated, this can lead to diabetes. Another risk factor for South Asians is the way we carry our weight. This again is related to how we may be more insulin resistant. We tend to carry our weight in our central abdominal region, also known as visceral fat. This may be reflected in an increased waist to hip ratio. Yet another manifestation of insulin resistance is the way our cholesterol can look. So when looking at our cholesterol parameters, there are three major components. There's the LDL, which is the bad cholesterol, the HDL, which is traditionally considered the good cholesterol, and triglycerides, which is yet another bad cholesterol, which can be related to diet and exercise patterns. We know that South Asians tend to have a lower HDL and a higher total cholesterol to HDL ratio. This can be a reflection of, again, insulin resistance. In addition, South Asians tend to have more genetic cholesterols that are elevated, such as lipoprotein(a). We're in a unique area in the Bay. We are well suited to technology and wearable devices. We can use this in our evaluation and treatment for our patients. We know that all people are not the same and that we need to tailor our treatments to the individual. Using the digital health data or the wearable technologies our patients are using can help us really customize how they can approach their risk factors and improve their heart healthy behaviors. There are some things that are within our control, and there are some that are not. We can control whether we know our numbers for high blood pressure and cholesterol, whether we avoid smoking or vaping, whether we exercise, whether we eat healthy. We may not be able to control our age and our family history. I really think it's important that we focus on the risk factors that we have control over and really work to improve them so that we can help mitigate some of those that we may not have so much control over. Understanding cardiovascular risk among South Asians is really a priority because even though we constitute only about 25% of the world's population, we carry 60% of the cardiovascular disease burden. I was lucky to be involved in the American Heart Association statement for cardiovascular disease in South Asians. For any of you who are interested in learning more, please consider downloading this freely viewable and downloadable document. With regards to next steps, there are several actions you can take to improve your cardiovascular health. I encourage you to pick one small behavior that you can change and make small incremental steps towards the ultimate goal. For some, it may mean sleeping a little bit earlier at night so that they can wake up for their morning walk. For others, it may mean walking away from the sweets table at a cultural event. During this pandemic, there will be challenges we will all face with regards to diet, stress, sleep, and exercise patterns. I encourage you all to stay motivated, to pick behaviors that will continue you on a successful path to heart health. Really, to achieve good heart health, it's a lifelong journey, and I wish you the best of success and hope you have a healthy one. Thank you for your time.